Okay, so initially when the baby comes out, it won't be wrapped in a blanket or with the hat on, but um, the first thing you'll want to do is suction their airway. So you'll suction the mouth first and then the nose. Um, Dry them off with a towel or blanket and then wrap them in the blanket, put the hat on, and then apply like the ID bracelet and like the safety bracelet that matches up with the mom's bracelet. Um, Next, you'll do the APGAR score, which can go up to 10. Um, Anything from 8 to 10, you would just, those are normal findings. Anything below that, you would have to intervene somehow. So you're checking activity, so like their muscle tone, if they're flaccid or like well flexed, the pulse, anything above 100, but the normal range for a baby is 110 to 160, so you would do that at the stump of the umbilical cord. Grimace, so if they're grimacing or crying, that's just assessing like their reflex irritability, appearance. So if they are pink all over or if they have some blue hands and feet, which is common. And then the respiration, so their cry strength, if it's like a good cry or if it's kind of like weak and slow. And then, yeah, anything 8 to 10 is normal for a newborn. And then you would do the medication. So there's 3 medications: the erythromycin, the antibiotic ointment across their eyes, the vitamin K shot in the vastus lateralis, and then the Hep B vaccine. So overall, like general guidelines are just assessing their airway, heart rate, their color, making sure that they're warm. So there's a blanket under them so that they're not losing heat from like contact, and doing that, like the heart rate and the respirations, that's in like the first minute assessment, but getting their vital signs, making sure that they're all normal, and then measuring. So you would get the length, the weight, the head circumference, and the chest circumference. It's normal for newborns to lose weight after they're born, so 10% or less, but anything above 10, that there could be an issue, and then they would hopefully regain that weight within like the 2nd week of life. And then after just kind of those like general things, you would start at the head and go down. So for the head to toe, you are going to be palpating the fontanelles on their head. So the anterior and the posterior. The anterior is the diamond shape and the posterior is the triangle. Just making sure that they're normal. So, assessing if they're flat, depressed, bulging. Some of the sutures might overlap, which is normal. And checking for molding, swelling, and the cephalohematoma. And then the eyes, so they may be crossed just due to like muscle weakness, but there could also be the pseudostrabismus, so just checking for that, looking at the epicanthal folds, the sclera for signs of jaundice, and then if there's any like discharge, that could mean that there is a potential infection. And then the ears, so the pinna should line up with the inner canthus of the eye, and then also looking for like that dimple or like the little skin tag, which could indicate maybe kidney issues, because the kidneys are being developed at the same time as the ears. So after the ears, you go to the nose. They are obligatory nose breathers, so you would have to check both nares for patency, checking for flaring, which could be like a sign of respiratory distress, and doing like plugging one nostril at a time, just to like assess patency, and you could also be doing that at the same time as like the sucking reflex too. But for the mouth, looking for the Epstein pearls, which are those like little benign cysts, which is normal, could be a normal finding. Presence of natal teeth, looking to see if they're like cyanotic around their mouth, and then assessing the hard palate, soft palate, and seeing if their tongue moves freely or if it's attached, which could impact breastfeeding and their speech eventually. Their neck, making sure the trachea is midline, and that there's no like palpable masses in their neck, making sure they don't have any webbing, which could indicate Turner syndrome. And then for the chest, just like the overall appearance, looking for like extra nipples. There could be like a bulging at the bottom of the sternum, which is normal. And then also looking to see if there's any discharge coming from the nipples. For the hands, again, like making sure there's no webbing, checking for like the single palmar crease, and then yeah, that's just it for the hands. Overall skin, so color, the vernix, lanugo, presence of like dry peeling skin, any like cyanosis or petechiae, like bruising, of birthmarks. So looking at the Mongolian and what's the other one? The cafe au lait spots. So those are like the pigmented ones. Also checking for like forceps marks on their face, any like birthmarks that blanch, like the vascular birthmarks. So you would just need to assess like the color and if they're flat or raised. And then moving to the abdomen, so making sure the umbilical cord has 3 vessels, so 2 arteries and 1 vein, and also assessing the shape of it. For the genitals, I'm just gonna take this diaper off. This doll is a male, but for a female, looking at the labia, if they're like edematous, and then the labia majora covering the minora. And then for males, looking at like the kind of like the texture of the scrotum. It shouldn't be smooth, it should have the rugae, and it should be edematous as well. Looking for like the hydrocele and all of that, and then the spine. So assessing if the spine is straight, just like palpating it and looking at their like coordination. So if they have like sporadic movements, looking at like the skin if it's intact, and then also looking for the tuft of hair or like the little dimple at the base, which could indicate spina bifida. So that's it for the spine. And then overall extremities, so just checking their range of motion, like making sure everything's kind of like symmetrical, like smooth. Looking at the creases on their feet, the soles of their feet, and then also assessing for the hip dysplasia. So there's 2 ways to do that. There's the Barlow and the Ortolani test. So the Barlow, you just adduct and go down, which these legs don't move very well, but you're adducting and going down, and then the ortolani is you're abducting and going up. And so you're looking for like a click or a clunk sound. And if you hear that, that could mean that like you're just putting the hip back into place and that there's like a displaced hip joint. And then after the extremities, one more thing is the creases on like the back of their thighs, making sure like the folds, the symmetrical folds, so if they're symmetrical or not, and club foot also. So then cardiovascular and respiratory, so just listening to the heart and lung sounds, the rate, rhythm, listening for like any abnormalities in their respirations, wheezing, like crackles, all of that. And then also assessing like the pulses. So you would do the apical pulse for a minute, the brachial, femoral, checking strength and making sure they're equal. The GI and GU, so are they jaundiced or not? If they are, they can be put under like a special light, assess for like any signs of bleeding, get their blood sugar for, hypoglycemia, assessing the patency of the anus, so did they go, looking at the characteristic of the stool, so the meconium is normal for the first stool, so that black, dark green, like tarry stool. And then for the urine, seeing like how much they go, assessing input and output. If they're breastfeeding, they'll probably have more stools. Pseudomenstruation, that's also normal. The brick dust is like the uric acid crystals, like the concentration in their urine, and I think that's it. Oh, and listening to their bowel sounds as well. Neurological, so just are they alert, doing the reflexes, they're crying, like the muscle tone, kind of what we already did before. Their head size, which we would have measured before, doing the Fontanelle assessment, and also checking if the baby's like jittery or if it has any tremors, anything like that, like maybe signs of like withdrawal from drugs if the mother is on drugs, any like CNS issues. So then for the reflexes, the sucking reflex, rooting, so seeing if they turn their cheek towards the stimuli, swallowing in the palmar and plantar grasp, so do they grasp your finger and then like do their toes curl around your finger. The Moro reflex, so like startling the child, making a loud noise, clapping, or doing like the drop thing. The tonic neck, so while they're laying down, you're turning their head and the extremities on that side will be straight, and then the arm on this side will kind of go over. The opposite side will bend, so that's a normal finding. And then the Babinski, so stroking upward on the foot, and their toes will hyperextend, and the big toe like dorsiflexes, which in an adult you don't want to see that, but in a newborn that's a normal finding. And after that, just making sure that they're being kept warm. You can do like the crawling, so you could place them like on their abdomen and they could like show signs of crawling, their arms and the legs, just another like reflex. But after that, make sure, like I said, keep them warm, I would put the diaper back on. If I took it off, wrap them in a blanket, put their hat back on, maybe double check like the armbands are still there and everything's in order. And that is it.